Rectal bleeding is a common condition patients present at a GI clinic. It usually appears as bright red blood which appears after a bowel movement, or it may stain your underwear or your toilet paper or even cause the toilet water to turn red. It is the color of the blood that helps identify the source of the bleeding. Bright red blood usually denotes that the bleeding is from the rectum or the anal canal. Maroon colored blood is often seen from diseases which include the colon, that is the proximal colon or the transverse colon, whereas foul smelling dark tarry stools are seen when the bleeding is from the stomach or the proximal small intestine. Not all bleeding is always visible, hence sometimes tests for the stool occult blood are essential, especially for patients with symptoms of anemia like fatigue and giddiness. Although rectal bleeding is a very common condition, only 20% seek medical attention at their first episode of bleeding. Sometimes symptoms can develop rather very acutely and the patient may require urgent hospitalization. But relax, most of the cases of rectal bleeding are benign and can be treated effectively. The commonest causes of rectal bleeding are hemorrhoids, which are swollen veins in the rectum and the anal canal, fissures, which is nothing but a break in the lining of the anal canal, anal abscesses or fistulas, diverticulosis or diverticulitis, which are nothing but pouches or pockets which are formed in the weakened part of the colon and can be inflamed and bleed, inflammatory bowel diseases, which comprises of ulcerative colitis and Crohn's disease, and sometimes colonic polyps or colorectal cancer. All these conditions can be diagnosed easily with a colonoscopy, and an effective treatment can be given to these patients. So if you have rectal bleeding, do seek your doctor immediately.